Good for.
Recording in progress.
Okay. Okay, space travel has grown during the past 2 decades and it's expected to surge in the future. By 2028, the National Space Administration in Houston, Texas plans to have a sustained presence on the moon and as a staging point for manned mission to Mars and elsewhere. Combining this right, treating physicians are bracing for an increase in space-related medical problems, including back pain. Back pain is highly prevalent in astronauts and space travelers, with most cases being transit and self-limited. Pathophysiological changes that affect the spine occur during space travel may attributed to microgravity, rapid acceleration and deceleration, and increased radiation. Understanding the epidemiology, causes, and potential treatments for spinal pain in astronauts has the potential to improve care for other populations. The pathophysiologic effects of space environment on spinal health. Space travel defined by crossing the line of 62 miles or 100 kilometers above Earth's mean sea level and exposure to microgravity have been linked to lasting present anatomical and physiological changes of the spinal column and surrounding musculature, which play a role in spinal pain. Data from earliest exploration in microgravity demonstrate that astronauts gain up to 3.1 inch of height in the first 9 days in space. MRI spine pre and post flight demonstrated a statistically significant decrease in lumbar lordosis. So it's become more straight and we lose the curve of our lumbar spine in space because of microgravity. This was associated with decreased active flexation and extension of lumbar spine by as much as 30%, as well as 20% decrease in functional cross-sectional area of the multifidus muscles, which play a key role in maintaining lumbar spinal stability. These changes occurred despite astronauts following International Space Station exercise protocols in space. Data from rats and rabbits flown into space revealed the reduction in proteoglycan and collagen content in the intervertebral disc. A decrease in proteoglycans has been linked to dehydration and aging and decreased ability of the intervertebral disc to sustain mechanical stress in humans. Microgravity may predispose space travelers to vertebral end plate fractures, which can either directly cause pain or result in the production of inflammatory cytokines into discs, which may result in pain when these cytokines come into contact with nerve ending. Lumbar spine MRI has revealed new and worsening posterolateral annular fissures on the disc. Bone mineral density of the spinal column decreases by about 1% per month during space travel. So this is show the changing. First of all, we are losing our lumbar spine curve, which will become more straight and it's become more longer. The multifidus muscles and other paraspinal muscles atrophy decreased in lumbar, of course, or lordosis, we say that. For a disc and between vertebral, we have annular tears on the disc, decrease of proteoglycan and collagen content in the disc, so that inflammatory cytokines, decreased bone mineral density, and increased risk of vertebral end plate fractures. And also we have stretching of the anterior and posterior ligament, tidal ligaments between the vertebra. So, and apart from the microgravity, astronauts are exposed to excess radiation from cosmic and solar sources in space. Mice exposed to radiation, though similar to that galactic cosmic rays, demonstrated compromised tubular and cortical bone. Radiation of skeletal muscles decreases adaptation to and inhibit recovery from overload. And this is a new information. The incidence of a herniated intervertebral disc in astronauts was 4.3 times higher than matched controls in a study that followed 983 astronauts during 50 years. This risk was not attributable to previous exposure to a high acceleration or vibratory forces like the astronauts with jet pilot experience had, because the astronauts with the jet pilot experience had a similar incidence. Risk of disc herniation was dramatically higher during the first 12 months upon return back, thus identifying the period of transition between microgravity and normal one as the most vulnerable period for injury. So this, we have the syndrome is called the space adaptation back pain.
If the ground is black and yellow, it's the same way. Down my head, don't feel my eyes, halfway on the shoulder. It's the same way it's sure. If you could fly, then you feel south, up north, get.
So space adaptation back pain syndrome that we are talking about now, most astronauts experience only transit self-limited low back pain upon initial exposure to microgravity, referred to as space adaptation back pain. In a large retrospective study of 722 astronauts flights, up to 52% of astronauts endorsed back pain. However, it was mild in more than 80% of the cases, with maximal onset during sleep periods between days 2 to 5 and end by day 12 of exposure to microgravity. Reduced axial loading of the can't read it here. Reduced axial loading of the spinal. I can't see this. Decreased reduces axial loading of the because of microgravity, so they decrease the hydrostatic pressure of the intervertebral disc, leading to increased fluid impactation. This would result in intervertebral disc swelling, stimulating the nonsusceptive fibers embedded in the disc, as well as type 4 mechanoreceptors. Spinal fixation or a fetal tuck position may relieve pain by promoting fluid diffusion away from intervertebral disc, thus relieving the stress from the fluid impactation. Also, intervertebral disc swelling has been demonstrated in microgravity models. MRI upon return to Earth has consistently failed to demonstrate intervertebral disc swelling. There's some studies or some reports that say small increases in disc height in some subjects were demonstrated during in-flight by ultrasound imaging on the International Space Station. And muscle have been implicated as possible pain generators secondary to strains, which may arise from reduced lumbar lordosis and spinal elongation. Increased tension on spinal ligaments and nerve roots secondary to spinal cord elongation may also result in pain. So the fatal tack position may relieve tension generated by reduced lordosis. In addition, lift off associated with significant whole body vibration in astronauts, which has been linked to musculoskeletal injury, tissue microtrauma, and chronic degenerative changes. So the basic preventative measures. First, we have to decrease the stress and trauma from traveling space vehicle. That's an engineer business. That space vehicle must be designed to best alien forces acceleration with human anatomy and to minimize radiation exposure. Crew selection for radiation sensitivity may have the highest payoff in reducing risk. Then the basic thing to prevent this back pain is to do something against the direct effect of the microgravity. So alternative to replicate gravity has been utilized for several decades. So we need to dynamic and static axle loading. So physical tension to emulate the effect to the gravity. That's what we have to do to as a dynamic and static axle loading. So dynamic axle loading include the use of exercises aimed at body region involved in resisting gravity, including the trunk, back, pelvis, and abdomen and lower extremities. Resistance exercise showing only partial protection against bone loss and muscle atrophy. The process is also time consuming, with astronauts spending around 2 to 3 hours per day for as many as 6 days per week on these efforts. A retrospective study of 722 astronauts' uh, flights demonstrated that two modalities of dynamic loading implemented in space, like treadmill with a harness and a cycle with ergometry, were 85% effective in relieving symptoms of space adaptation back pain. This exercise device may not be compatible with a long distance space travel where in vehicles are restricted on allocations for volume and mass. The static axle loading, we have two type of suits that the instrument has to wear. The being given suit which utilizes a belt placed on the waist with elastic bands extending to the shoulders and legs. Although this system was shown to reduce muscle atrophy and bone mineral density loss, but it had a design limitation. Also, we have another suit, the skin suit, which utilizes a breathable bidirectional elastic microwave to progressively increase tension on the limbs and the spine. Challenges of the extended mission include higher minute ventilation and during exercise testing and violence in fat and impaired joint motion. This is the two suit, the being given suit and the skin suit. See the belt rubber and the elastic also to keep a big pressure of the spine to reduce the spaces between vertebra and to keep it try to have some curve of our the lumbar spine. And the other one is skin suit also do the same job. Space-associated nutritional deficits, imbalance causing tissue dysfunction and impaired healing. The space environment may increase metabolism, thereby accelerating muscle atrophy. Voluntary dietary intake is reduced during space flight by about 20%, while serum level vitamins B, D, E, and K impacted. So plans to prevent and correct the deficiencies are important. Bisphosphonate supplementation combined with resistive exercise and supplementation with resin, a myokine released after physical exercise, which has been shown to prevent and restore bone loss and muscle atrophy in animals. Additional prevention strategies. We have a neuromuscular electric stimulation, which creates passive contractions of skeletal muscles and increases muscle blood flow. Its use appears to be less effective than stabilizing exercises. Lower body negative pressure devices apply ambient pressure lower than atmospheric pressure to the lower body to induce footward fluid shift. Combined with treadmill running, lower body negative pressure can generate a force similar to body weight as measured on airs. This technology has been used on the Mir space station and shuttle programs. Research shows this modality is associated with normalized lumbar lordosis, spine length, and intervertebral disc height compared to control subjects. Psychology consideration. In a retrospective study evaluating 86 astronauts volunteers exposed to simulated space flight. 21% individuals self-reported anxiety. Also, the incidence of anxiety and depression in astronauts have not been extensively evaluated. There is evidence from post-mission report that astronauts, particularly those involved in a long-duration space mission, exhibit an anxiety related to a mission itself and peer-to-peer interaction, as well as depression and loneliness, along with other psychological morbidities. Treatment may have cognitive and psychomotor effects, and therefore are not routinely prescribed in astronauts. Larger mission may also include astronauts trained to administer not only first aid, but also acute mental health care. The diagnosis and the treatment. Back pain in space travelers should be evaluated with a history documenting motor and or sensory deficits, as well as bowel or bladder changes, which may suggest serious pathology. This is important because the classification of spinal pain as neuropathic or non-neuropathic has prognostic and treatment implications at all levels of care. The physical exam should include a neurological assessment of strength and sensation and spinal reflex testing, which can be accomplished remotely. History can also be help differentiate adaptation back pain from other common causes of low back pain. After more serious causes of in-flight back pain have been ruled out, example acute radiculopathy from a herniated disc, and a diagnosis of space adaptation back pain is suggested, conservative management is appropriate. Generally, nonsteroidal anti-inflammatory drugs such as naproxen or ibuprofen, shorter acting, taken for 2 to 3 days, is sufficient to manage symptoms. However, if severe muscle spasms present, a muscle relaxant may be added. Given the risk for physical dependent and prominent psychomotor effects, benzodiazepines should be not be a first line treatment for space adaptation back pain. In addition to oral analgesics, spinal loading, position changes such as knees to chest, hip flexation, and use of the chair have been shown to treat symptoms. It's also to support our back and support our lumbar spine care. As space adaptation, back pain appears to be most symptomatic while sleeping. So sleep position changes can be made by shortening the sleeping bag at the foot end to prevent full extension of the legs, thereby creating a partial knees to chest tuck position. This same position can be obtained by sleeping strapped into a space vehicle capsule seat. It's rare for space adaptation back pain to persist beyond flight day 12, with most cases resolving by day 5. Back pain persisting longer than 12 days or described with neuropathic characteristics should raise suspicion for a more serious etiology. Spinal loading via exercise can also be used to treat space adaptation back pain. However, care must be taken to avoid exercise-related injury trauma, which could confound the picture. While space exercising early in is encouraged, uh, beginning with aerobic training and progressing to resistance training with gradual increase in percentage body weight load as tolerated. So the message that's even space we have to exercise. Thank you. Thank you. Thank you. Any comment, question? I guess at the same time, before the astronauts go to space, they also need to be equipped. So, yeah. Of course, the most important the history to be sure that this is back pain is not related to any other issue. Yeah. No, somebody. Meine Wahl, ein Termin drauf gesprochen.
Genau.
Yes, I tell you for me.